Who is at risk of getting skin cancers? Well, the simple answer to this is Australians. And about 10% of the world's skin cancers occur amongst Australians. And Australians have the highest rate of skin cancer of any other country in the world. And amongst Australians, the people who are at most risk are the people who sunburn easily. These are people with fair skin, blue or green eyes, fair hair, who come from a Northern European ancestry. Even though the risk is slightly lower if you have an olive complexion or even a dark complexion, the risk is still not zero. So pretty much any Australian can get a skin cancer. There are also a couple of special groups who are at very high risk of getting skin cancer. And those are people who have a problem with their immune system, and that might be caused by medications that they're taking. A classic example is people who have had an organ transplant and are on immune modulatory medications to prevent them rejecting their organ. That also can compromise the way in which the body's immune system fights against the cancers. And we also know that there are some people who just are more genetically susceptible to cancer, and sometimes we can look at their skin and we can identify various markers on their skin that predict that. So with regards to melanoma, which is the most dangerous form of skin cancer, when we examine someone and we notice that they've got a lot of moles, particularly if they've got a lot of what we call dysplastic nevi, which are large, irregularly shaped moles, those are people who are at increased risk of melanoma, but also people who have had a melanoma affecting a first-degree relative have a higher risk. And so there's a range of factors that the dermatologist will take into consideration in determining what your individual risk is of developing a skin cancer.